Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about the topic mom brain. Mom brain is also called a pregnancy brain or mommy brain. It refers to forgetfulness, mental fog, difficulty in concentrating, or feeling less mentally sharp that some women experiences during pregnancy and after childbirth. The reason why I took this topic is I recently met a lady who had her pregnancy or who had her labor recently. She was complaining about the forgetfulness. She forgot her baby's appointment. She forgot her baby's formulas, where she put it some moments ago, and something like that. Before delivery, she was working. She was working, and she was an intelligent woman. But after delivery, she's experiencing something like she has a brain fog, and she forgets everything, and she finds herself in difficulty in concentrating. Let's look into why this happens. It is not like you are losing your intelligence or you are something happening in your brain. No, it is not like that. What happens is here is brain enters in a stage of rewiring for some time due to the hormonal effect that is occurring in your body after the pregnancy time. Okay. So what your brain do at that time is to your brain that time baby is the most priority item or the most priority thing in your brain at that time is your baby. So the brain rewire itself and don't take unwanted things much more into your brain at those times. Okay, so let's look into some detailed points happening in mommy brain. Okay, common symptoms include forgetting appointments or where you put the things are, difficulty in concentrating, feeling mentally slower or distracted. Most women complain about they have trouble in multitasking, and you may feel increased absent-mindedness. The possible causes of these mommy brain include hormonal changes during pregnancy and postpartum, sleep deprivation and fatigue, stress and anxiety related to caring for a baby, increased mental workload and responsibilities, physical recovery after childbirth. Researchers suggest that pregnancy and motherhood can cause changes in brain, but these changes may help mothers to become more responsive to their baby rather than indicating a loss of intelligence. Many women notice improvement as sleep and routine stabilizes. If if memory problems are severe, worsening, or accompanied by significant sadness, anxiety, or difficulty in functioning, it may be worth discussing with a health professional, as conditions such as postpartum depression or other health issues can sometimes contribute. So, next question, is it normal? Yes, the mom brain is very common and usually normal, especially during pregnancy and the first year after having the baby. Many mothers experiences occasional forgetfulness, difficulty concentrating, feeling mentally foggy, misplacing items more often, trouble remembering names, date, or task, etc. These symptoms are often related to lack of sleep, hormonal changes, stress, and increased mental demands of caring for the child. For most women, these symptoms improve over the time as sleep routine and overall well-being stabilizes. However, it's good to talk with a healthcare provider if memory problems are severe, getting worse, they interfere significantly with the daily life. You also have persistent sadness, anxiety, hopelessness, or loss of interest in activities, which could suggest conditions such as postpartum depression. Now, let's look into the next question. How long does it take to get better? The timeline varies from person to person, but most mothers, the mom brain gradually improves after several months as sleep and daily routine gets better or become more stable. Let me give you a general guide. First few weeks to months postpartum, mental fog and forgetfulness are often most noticeable due to sleep deprivation and recovery from the childbirth. Around 6 to 12 months postpartum, many women notice significant improvement as their baby sleeps longer and they adjust to their new routine. Beyond 1 year, some mothers still report occasional forgetfulness, but it is usually much less disruptive. Some factors that can also affect recovery include sleep quality and quantity, stress levels, support from family and friends, physical health including thyroid functions, anemia and nutrition, and mental health. If symptoms are persistent, severe, or worsening, it's worth discussing them with healthcare provider to rule out issues such as postpartum depression, anemia, or thyroid problems. So that's all about today's topic. We are stopping over here and we will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.